I will be discussing how to study pathology and microbiology, which is a minor in first year. Now, please keep in mind that this subject is not taught at every medical school in first year. However, it is taught at my university, which is Dow. So, I would like to just put that disclaimer out there. Now, for pathology, there's 4 basics that you do need to know what they are: etiology, pathogenesis, morphology, and clinical manifestations. So for each disease or condition that you study, you need to know these, 4 basics. So etiology has to do with cause, pathogenesis has to do with the mechanism, morphology has to do with the appearance, and clinical manifestations have to do with the symptoms and what you see, clinically. Understanding these 4 concepts is very important. So pathology, if I define this subject for you, it is a study of diseases, but it's the subject that brings all subjects together. It is why we have medicine. It's because we have disease that we study medicine, that we study the treatments of disease, that we study all these other subjects. It all comes down to pathology. Now, before you look through pathology, you need to know what is physiology. So you need to know what is normal before you know what is abnormal. And that is something I would like everyone to understand. Now, the books for this course that are needed are Cotran and Robbins' Basis Pathology. I have a lot of my textbooks on PDF form because I can usually view them on my phone too. So I find that more helpful. But if you want to buy the book, it's totally up to you. And for Robbins and Cotran, how I use this book for first year, well, I tried 2 different things. At first, I actually tried reading through the chapters of the book, and I'll explain to you how that worked. And then the other thing that I did, which I think was more effective, was I focused on the orange and the blue boxes within this book. However, the main book that I used to study this subject was Golgi Pathology, which is this one right here. It's for USMLE, and it's a really great book. It puts everything into bullet form, so there's no big paragraphs. It's not overwhelming like Basis is. Now, for this, I do want to clarify that it's not basic. It is basis. So please don't get basic. It's way bigger of a textbook. You just need basis if you want a reference textbook for, more detailed pathology. Now, the most important book that you need for this course, and I think every medical student will tell you this, is Pathoma. Pathoma by Dr. Hussain Abdul Sattar, and he has done an amazing job at writing this book for USMLE prep, but it is so relevant to even any normal medical educational system. I would highly recommend looking through this book and following it through with the videos. There are videos that Dr. Sattar has made, and so don't just read through it. It is a review book. It's not meant to teach you. It's meant to give you the high yield testable material. Now, how to study it effectively. Before I go into that, I want to talk about the experience of reading Basis. Now, with textbooks in med school, initially when I started in first year, I would read through all the textbooks because that's kind of what I was taught. By the end of it, I realized that you don't really need to do that. A lot of times what's best is to use a combination of different resources to really have a better understanding of, the subject. So instead of just relying on textbooks, try using creative means, YouTube, any other way to really make your learning experience more interesting and engaging. Now, when it comes to reading through Basis, it really is a choice that you make. However, considering the time crunch as a medical student, it is a bit of a challenge to actually find time to read Basis because the chapters are very long and they're very detailed, and you do not need to know all those details for your test. And additionally, you probably won't be able to find the time to actually read through all those chapters. The curriculum is very fast-paced, so it comes down to a choice. I did read through it for my, anemias, and I did find it helpful because it was super detailed, but I feel that for optimal efficiency, Golgi Pathology works way better because it's all in bullet form, and it is much more better of an experience than basis is. The other challenge with basis is understanding, especially if you're not someone who has strong English skills. It can be a challenge because it is a bit of a wordy book with a lot of, medical jargon thrown out there. So, in understanding it, it can also be a challenge because it requires a bit of comprehension. However, I think that is pretty much similar for all medical textbooks, so you do need to know how to read medical textbooks, and that's kind of the language that is displayed within those. So that is an important skill. But for optimal efficiency, I would go with Golgi, and that's what I did, and I found it really effective. And I also used Pathoma. For basis, towards a final exam season, I actually just looked at the orange boxes and the blue boxes within the textbook. And the orange boxes contains morphology, and they've got really good points and really good images within the textbook on morphology. Let's say you want to look at how caseous necrosis looks like. You can read an orange box on the morphology of it, and they describe to you how it looks like. And for more for the blue boxes, they're more like summaries. It basically like puts the chapter or like a section of the chapter into like quick few bullet points and gives you a summary of them, and that's really helpful also. I didn't do it throughout the year. I did it when I was studying for my final exams. Sometimes images will appear on your exam. Sometimes images within basis are pretty relevant, so I do recommend looking at those images, especially if it's like histological slides for certain conditions, like for example myocardial infarction. You need to know how the histological slide looks like. And also the other morphology, which is the pathological, if you have like a postmortem heart with myocardial scar, how would that look like, right? So these are images that you do need to have in your head, and they do show up in Pathoma as well. So don't leave images out of the story. They are very, very relevant for the understanding the morphology of different diseases. Now, first step would be to watch an osmosis video or another introductory video to prep your brain, and make sure you've covered your physiology first. So the next thing is, this is up to you. You can either read through the Golgi first, or you can do Pathoma first. If you like the other way around, where you do Pathoma first and then you've got all the high yield content and then you go for the nitty-gritty information, you can do that. But if you want to read through maybe Golgi first, then go to high yield content, it's up to you how you do it. But yeah, so you're just going to be using those two books. That's what worked best for me, especially in terms of time efficiency. Now, I used basis for the orange and blue boxes towards my final exams. You can do this throughout the year. It's totally up to you. I just discovered it toward the end. Now, any additional information, just note it down on Pathoma. Just anything additional, use Pathoma as that review book. They have like a little space on each page for you to write notes on, so really helpful. Now, I would cover through lecture slides for any testable material. I did attend a lot of my pathology lectures because I found them really useful, so it depends on how your uni does it and how effective those slides are for you. Now, I would make Anki cards for anything I could forget, which in pathology there's a lot. So clinical manifestations of diseases, virtuous triad, the mediators that are involved, particularly let's say in asthma, high yield facts, high yield, all of Pathoma, you can probably turn it into a bunch of Anki cards. So really look for the relevant and testable material for your year. I mean, you're not studying for the USMLE, so you want to look for testable material that is relevant to your curriculum in Pathoma. There are some extra things, and it's good to know them, but it is not necessary. Now, one of the resources I would recommend using for this subject is first aid, and that is to take your understanding to a more, higher level. And first aid is actually really useful for understanding different pathological conditions. It's gotten everything kind of organized into different organ systems and then into different subjects. But for pathology particularly, it has really good bullet points on them that you can use to really focus on high yield information. Now, for minor subjects, like radiology, clinical medicine, you always want to be able to relate it back to pathology. You might have a couple of lectures that are maybe on radiology, or reading like a chest x-ray and everything. And for that, I would say things like curly bee lines, they're not very relevant to our year, but it's good to know and relate these subjects back to pathological conditions. Even things like the healing of a fracture, which comes up in orthopedics. Clinical medicine, things like PFTs, which are pulmonary function tests, and knowing how they correlate with different pathological conditions like COPDs and restrictive lung diseases. So these are things, these are minor subjects that might come up. You might have a lecture or two about them. So it's good to always relate them back to the pathology as well. Now, this is an important, I guess, concept for pathology, and that is active recall and spaced repetition. And I know I've said it for every subject, but for pathology, I think it is the most important. You have to constantly test yourself on how diseases work, the mechanism behind them, what is deficient, what is more, what goes up, what goes down. You do need to know a lot of things about diseases in terms of their cause, their morphology, the clinical manifestations. All that stuff is very, very relevant, and it is forgettable information. So active recall is highly suggested for pathology, especially. Now, additional resources, I've mentioned this before, is first aid. Now, a bit about pathology is that it is one of those subjects that is coupled with understanding and memorization. So you do need to memorize a couple of things like clinical manifestations, but the understanding part would be more of, why is thing A clinical manifestation of this disease? Why do you see jaundice maybe in a certain disease? Why? So knowing the mechanism and the chemistry and the histology and possibly the pathophysiology behind why there's certain clinical manifestations, why there's certain morphologies. These are all important points. So it's both memorization and understanding. Now, the minor subject is microbio. So for microbio, you don't actually do a lot of it in first year. It is more relevant to your, I guess, respiratory module when you're learning about the respiratory system, and you need to know, what bacteria cause different types of pneumonia. So that's where I would say it's like most relevant. But in terms of first year, you just need to know a lot of the basics. So like gram-negative, gram-positive, what's the difference between bacteria and viruses, and just really have a basic understanding of the bacterial cell wall, pathogenesis, normal flora. These are like basic concepts that are important in first year, as well as, some of the pneumonias you'll be learning. Most medical schools will tell you, hey, use Levinson's, and it is one of those textbooks that is very lengthy and detailed, and I did read it for one unit. I found it helpful, but I also found it unnecessary because I don't think I needed to go into that detail being a first year student. So it does take a long time to go through Levinson. So I guess a time efficient book that I would suggest is Clinical Microbiology Made Ridiculously Simple. This book is, I don't know, the genius behind this book has made this book a beautiful, I guess, resource for medical students, because this book uses like visual diagrams, characters, funny stories to explain to you microbiology so that you retain it better. So it's all that idea of, I don't know if you guys have heard of Sketchy Pharma and Sketchy Micro, where they kind of use cartoons to explain to you everything so that you remember it more. So that's kind of this book as well, and it's very helpful. One of the awesome things about this book is at the end of every chapter they have a chart to help you know everything about every little bug. So it puts things into great perspective when you are at final exam season and you need to know maybe a couple of bugs here and there. However, you're not going to have to read through this whole book, I would say. You are going to need to know like the genetics behind, different bacterial, like transduction, transformation. Those are important concepts. But most of the bugs, or the little bugs, you can even learn them through lecture slides, and some appear in Pathoma as well. But another book that may be helpful is Medical Microbiology and Immunology by Sharjeel Osmani and Najib Ahmed. This book is also really helpful. It's very, very small. Like, it is literally like near to nothing. And it puts all of that information into this little book. However, there are grammar issues. There are a couple of those issues within the book. So just giving that disclaimer, it is a local book. It's a Pakistani book. And it is totally up to you to buy it. And and as far as Levinson goes, once again, it's up to you. If you have the time to dedicate to reading a textbook, then go for it. But I personally find this book to be much more faster, much more efficient in terms of our learning requirements. I think that covers up most of what I needed to say about microbiology and pathology. Now, with these two subjects, obviously you don't do a lot of microbiology in first year. I think I'm probably going to make a video in the future more in detail about the real microbiology, which is a lot of memorization, and that will come more so later on. But this was just, I guess, a short way of summarizing what this subject requires for first year. Now, that wraps up my video. If you guys have any questions, please do get in touch with me and we can talk about it. I do respond pretty fast, so hopefully I can get back to you as soon as possible. And follow my blog, Instagram page, subscribe to my YouTube channel, like, comment, share. Let me know what you guys want me to post, what type of content you want to see, and yeah, that's it. Thank you for watching.